You know you're a nurse when you find yourself complimenting a complete stranger on his veins. That's from nurselink.com. Nursing is an incredibly hard and challenging career to pursue, although most people think it's not that challenging. The jobs and schooling give a nursing student lots of obstacles to overcome, and that's why I think people should become more informed on what it takes to form and educate a nursing student. When I was in high school, it had been my dream to be a neonatal doctor, so it had not always been my dream to be a nurse, but something in the medical field. And after doing more research about all the schooling and everything it takes to be one, I switched that to teaching. And then I had a child psych class that brought back my dream of wanting to be in the medical field and decided to be a nurse to be active with my patients all the time and to really get a good experience with them. Today I'm going to talk to you about the background and fun facts about nursing, the schooling for nurses, and some of the hardships and job duties that a nurse does. There are many types of nurses. There's a pediatrics nurse that deals with kids, usually from like age 1 to 18 when they're out of the NICU or out of that. Neonatal, which is when babies would be in the NICU. They're going to deal with premature babies that are sick or need extra help. And then labor and delivery nurses, which they deliver the babies and they help care for them when they first come out of the womb. These are just a couple examples of nurses. These are specialties that nurses can go into, and these are just mainly the ones that deal with the kids. Some fun facts about nurses. The largest demand for licensed practical nurses through 2,110 will be in nursing homes. Walt Whitman's service as a nurse during the American Civil War inspired many of his poems, including memoranda during the war. And then finally, there are more nurses than any other workers in the health profession. There are two basic kinds of nurses, an LPN and an RN. LPN stands for licensed practical nurse, and then an RN stands for a registered nurse. And the basic differences between them is an LPN has gone to a community college, and they've gone to school for about 2 to 3 years, whereas a registered nurse has gone to a 4-year college and gotten their bachelor's degree, and they usually go for anywhere between 3, 4, or 5 years, just depending on their program. So some basic differences in duties that they perform. An LPN will check blood pressure and put in catheters. They'll make sure that their patients are comforted by having a comfy bed, a bath. They do all kind of the nitty-gritty stuff. And then they'll report patient health to registered nurses or other medical professional. A RN will give medication and treat the patients. They'll perform diagnostic tests and analyze results. They'll instruct patients on how to manage their treatment outside of the hospital, and then they will oversee other workers such as LPNs. In terms of salary and certification that both of these need, an LPN usually makes around $42,490, whereas a RN makes around $66,620. So there's a little bit of a gap between the two in terms of how much money they make. And then a LPN will take a test called the NCLEX or PN, which is the National Certification Licensing exam for nurses to get their license in nursing and being an LPN. And then the same for an RN, but it'll be the NCLEX RN. So it's similar in the testing, but it's different in the amount of information that's on it and the type of license you get after it. So this is a list of classes from Chamberlain School of Nursing that a standard BSN program will give you. You'll take your basic classes such as human anatomy and physiology, chemistry, and then intro to inorganic chemistry. And then your math classes will mostly just be college algebra and then statistics. And for English and social studies, it's the pretty basic classes, just English composition 1 and 2, and then a poli-sci class and a history class. Getting more into nursing classes, those will start usually your second year. This is a 3-year program, so they start it's a trimester program, so in the third year, or the third semester of your first year, you start taking your nursing classes. And some of those will be pharmacology, which is basically all of the medications and prescriptions that could be given to a patient and for any disease or anything. And then pathophysiology is any disease or problem that they could have, and then like the in-depth description of each of those. They have many types of clinical classes which deal pretty much in any specialty that you could go into as a nurse. So you'll have your pediatrics, they won't give you a neonatal one just because that's a more controlled environment, but you'll have labor and delivery, psychology, and critical care. So you'll get a little taste of all of them in case you aren't positive on what specialty you want to go into once you get out of nursing school. You can go on to get your master's, in which you would then be called a nurse practitioner, and you can get that in just basic nursing, or you can get that just to be a specialized nurse, or you can get that in a specialty such as pediatrics or neonatal. And usually what that 2-year program will be, takes about 2 years for that, and it'll usually be 2 years of more experience in that specialty, or just 2 more years of experience being a nurse, and you'll go into further knowledge of certain classes such as pharmacology and pathophysiology. Let's say you're going for pediatrics, you're going to learn more about diseases and medications that are going to go towards those, towards diseases that for children, not so much for adults or like the whole group. You'll just go for more children. And then some responsibilities that a nurse has and duties that they perform. They'll put in catheters. They'll make sure that a patient is comfy, changing their bed, making their bed. They'll give them baths. They'll perform some procedures, not too many. They'll put in IVs. They can perform tracheotomies. They can suture them up. They can take blood. They can do pretty much the basic stuff. And then if you're a nurse practitioner, you can prescribe some medication to them, except for narcotics. So you get to prescribe some medications as well. And then there are some unfortunate events that happen when you're a nurse. Just if a patient dies or you just have a hard time with a patient, that can be tough on you. Save 1 life, you're a hero. Save 100 lives, you're a nurse. That's unknown. And here's my audience.